Hi, my name is Andrea Green, ADN student at Loyola State College, and today I'm going to be demonstrating skills regarding central lines. This includes a blood draw, dressing change, and administering medication through the central line. So first, I'm going to verify that I have some healthcare provider orders with my MAR. So I'm going to perform hand hygiene, and I see I have client Chester Chest, date of birth 7/19 of 19, and that is the same on my healthcare provider orders as well. So I see the provider is ordering give all IV medications in the central line, use the port for all blood draws, and central line dressing every 7 days. As well as ceftriaxone 1 gram is going to be administered today. So they're requesting a CBC and a CMP right now, so I know I need to do the blood draw. And then Mr. Chest currently has an infection, so I know I need to give the ceftriaxone, and it has been over the 8 hours, so I'm okay to give that today as well. And then the dressing change was 7 days ago today, so I'm going to change that for him as well. So once I verified my healthcare provider orders and my MAR, I'm going to perform hand hygiene again and enter my patient's room. Hi there, can you confirm your name and date of birth for me? Chester Chest, 7/19 of 19. Okay, and that matches. Okay, Mr. Chest, so today we have a few procedures today. So first I have to get a blood draw. The provider is requesting some labs. Do you have any questions about that? You don't? Okay. So I would have the lab tech with me so that she could take the sample. So first we are going to clean the port. 10 to 15 seconds in a circular motion, then we're going to let that dry. And then we're going to grab our 10 milliliter flush. And once that is dry, we can attach the flush. And then we're going to want to unlock. And then we want to aspirate until we see some blood return, and I see some blood return coming up. So now we can do a push-pause method to administer this flush. So once that's administered, I'm going to want to keep my hand on the plunger and lock. And then I can, I can also withdraw with the same syringe. So once that's gone through, I'm going to withdraw 10 milliliters of blood. And then I will lock. And I'm going to discard this sample. And then I'm going to need a new 10 milliliter syringe to attach. And then I can withdraw 10 milliliters. I'm not going to withdraw 10 milliliters. And then we'll lock again. So then I can hand this to the lab tech, and she can take it and label it and take it down for that test that the provider's ordered. And I've kept this above and not touched it, so I don't need to re-clean it. So I kept it clean. And then we need to flush one more time. So we'll attach that. Unlock. And again, a push-pause method to flush. And then keep your hand on the plunger and lock. And now that that is complete, the blood draw can go down to the lab, and we can clean up our workstation and perform hand hygiene. And then I also have a dressing change for Mr. Chest, so I've brought that in the room with me here. My sterile kit, as well as some things that I'm going to have to add into the kit as well. So I'm going to perform my hand hygiene, and I verified again that I need to change the dressing, as on this label it says that it was changed 7 days ago. So we're okay to change that, and I haven't left the room, so I would verify my patient one more time just to be safe. So first we are going to, because we have to grab some things from the kit and add one thing in, I'm just going to open the kit. Normally we would have all the things in the kit and we wouldn't have to do this until we were ready to become sterile. So I'm going to need this mask for my patient is why I'm opening it, and I'm also going to add this in there, as it should usually be in there. So we're just going to open this and add it in there so it's ready for when I become sterile. Okay, so now we're going to pretend that this was never opened and that everything was in there already. And we're going to provide a mask for our patient. So we will put this on the patient. And then also just extra precaution, we're going to ask the patient to turn their head away from these sites. They're going to turn their head this way. And then I've done my hand hygiene and I can don gloves. So while I'm doing this, I want to assess the port site and make sure that it's within normal limits, that there's no signs of infection and all that. So first we're going to take off this dressing. So we're going to peel up all the corners. We want to peel up all the corners and then pull it inwards. And again, their mask is on and their head is turned away, and I have a mask on myself already. Okay, so careful not to touch the insertion site, and then this can be discarded. As well as with my gloves. And I'll perform hand hygiene again, and then I'm going to become sterile. So we'll open our dressing kit now. Okay, and take out our gloves. As well, before we open our gloves, or sorry, actually yes, we want to do our gloves first, and then I will lay down the sterile drape. Okay, so first we are going to grab the inside of the cup and slide our hand in. Careful not to touch the outside of the sterile glove, and pull it down from the inside. And then we are going to do the same with this one. And then just pulling it down, making sure to be sterile. So now that I'm sterile, I'm just going to discard this and pull it out of my way. And then I can pull my drape. And we're just going to put this right over here, making sure to stay sterile and not touching the patient's skin. So then I can grab my Q-tip here as well and get out any gunk that might be around the side of the port. And I can discard of that. And then I'm going to want to clean. So because I'm going to be cleaning, I'm going to have to make one hand unsterile. Sorry, I forgot to mention, after I took off the dressing, I would have measured the port, the length of the tubing. So I'm going to want to clean inner to outer. In a circular motion. And once that's clean, I can discard of that and then let it dry. And I'm going to grab my padding here and then insert it right there. Okay, And now I can put on the dressing. So careful just to touch the outer corners with this unsterile hand that I have here. And place it over the port. So now that this dressing is on, I no longer have to worry about staying sterile. So I have another little piece of tape here that I can add. I'm going to initial it, date it, and time it. So then in 7 days or PRN, the next nurse knows when to change it. So now that the dressing change is complete, I can clean up my workstation. And I make sure the dressing's intact and like I've assessed the site and everything like that, and I would document afterwards as well. So I'm just going to clean up my workstation quickly. And perform hand hygiene. So I'm going to perform hand hygiene, and now I'm back in my bedroom because I see I have an order to administer ceftriaxone 1 gram. So I'm going to need to pull from my Pyxis. I have my 2 saline flushes. I need to pull from my Pyxis my ceftriaxone and my heparin flush as well. So my first med check, I see I have ceftriaxone 1 gram, and it's a pre-filled vial, and it's set at 10 milliliters, so I know that that is correct. And then I also have my heparin flush, 500 units per 5 milliliters. So, and this is 5 milliliters, so I know this is correct as well. Before I leave the med room, I'm going to do a second check as well. I'm also going to get it verified with a nurse. So my camera person is going to verify that I have ceftriaxone 1 gram, and that is at 10 milliliters. And then that I also have heparin, and that this is set at 5 milliliters as well. So now that I've verified with my second person that both of those are accurate, I'm going to complete my second med check right before I leave the room. Heparin IV flush, 500 units, 5 milliliters. It's at 5 milliliters, and my nurse can verify that with me. Ceftriaxone 1 gram IV push. It's at 10 milliliters. So both those are verified, so now I can perform hand hygiene and enter my client's room again. So I greet my client again, and I would ask them to confirm their name and date of birth for me. So Chester Chess, 7/19 of 19. Okay, Chester, so I have some medication here for you. It's ceftriaxone, so it's for your current infection you have. Do you have any questions about the medication? You don't. Okay, you've been getting it for a few days. Okay, I see your last dose was 8 hours ago, so we're okay to give this again. So, first we are going to clean the port. (10 to 15 seconds in a circular motion. And then we're going to let it dry. And first we need to flush. And get the air out. Okay, so then this is cleaned and dried, so I can attach this, and then I'm going to unclamp my tubing. So I'm going to aspirate to make sure that I see a blood return, make sure the line is still patent, and it is. I see some blood coming back, and now I can do a push-pause method. So while this is still hooked, I'm going to lock that, keep my hands on the plunger, and then unhook this. And now I have my ceftriaxone to give. So one last time before I give it, I'm going to do my last med check. So I have ceftriaxone 1 gram and 10 milliliters per 1 gram. And it was given 8 hours ago, so I'm good to give it. So undo that and make sure that the air bubble is out. And then we can attach this because we have kept the top clean. And then unclamp that. And another push-pause method. Now ceftriaxone we need to administer about 2 to 3 minutes. So a slower administration, but for video purposes, we're just going to do the push-pause method until it's all into the patient. But 2 to 3 minutes is about how long we'd want to administer it. So once that's administered, I'm going to clamp it again and take this off, and now I need to flush with normal saline. Attach that once the air bubbles out, and unlock and push pause again. So we want to do the push pause method every time we administer something into the central line so that it creates some turbulence. And then hold our hand on the plunger while we lock it and undo this. So lastly, we have our heparin, which I've already verified with my nurse. I'm just going to do my last check to make sure that I'm okay to give this heparin. So it's heparin IV flush, 500 units per 5 milliliters. That matches with my MAR, and this is set at 5 milliliters like my nurse already verified. So we can do that and get the air bubble out. And then attach this. Now if I were to ever break plain procedure and touch the end of the port, I would need to clean it again, but I have yet to do that, so I'm going to unlock this. And a push-pause method for this as well, until it is administered. Okay, so once that's administered, I'm going to want to lock it again, and unhook this and clean up my workstation. And I'm going to probably want to stay with my patient, even though they've had ceftriaxone before, for about 15 minutes, just make sure there's no allergic reactions. And then once that's completed, make sure my patient doesn't need anything, all the safety checks are completed, and then I'm going to go back and document. And I'm going to document, first I'm going to document my blood draw, and then I'm going to document my dressing change, what the site looked like before I changed it, the measurement of the tubing that I took, as well as the time that I changed it, and as well the medication that I verified it with another nurse, the time I administered it, that I saline flushed it, medication, saline flushed it, and then heparin flushed it after that. So once all my documentation is completed, then the skill is completed as well.